It's been critical to collect high-quality samples, high-quality data from patients that have been infected with COVID-19 virus to ensure that, there's so many things that we don't know about COVID-19 infection so far. There's a lot of questions still around, especially on the long COVID, the pathophysiology of this infection, of this affection, I should say. So it is extremely important to collect again data and samples from infected patients to determine again to try to answer some of the questions that we have regarding those patients. In Sherbrooke, we have opened the first clinic, the first post-COVID clinic in Quebec, and we've been running this clinic since May of 2020, and we have seen so far about 450 patients. So it's the clinic that has seen more patients in Quebec than any other clinics. Actually, there's only a few clinics in Quebec that are collecting samples and participating to the BQC19. So most of our patients, most of the patients that are seen at our clinics are recruited in the BQC19 biobank. Most of the patients seen at the clinic are non-hospitalized patients, so they are mild disease, and most of them have been presenting long COVID symptoms. So it's very heterogeneous actually, and different people will have different symptoms, but again, most will present with at least 3 or 4 different symptoms, fatigue being the one that's the most common. Usually we treat infection and we cure them with antibiotics, and it lasts a couple of weeks at least, and we don't have a lot to offer to them right now. No specific medication, so it's urgent that we understand the pathophysiology of COVID, of long COVID, to be able to help those patients significantly. The samples of those patients will help us determine what is the cause of the disease. Is it an inflammatory problem? Is it viral disease persistence? Is it something else, autoantibodies? So the blood test and the samples that those patients give will be very, very, very helpful to understand that, and I'm expecting that within the next year or so, we're gonna have a much better idea of the mechanisms of the disease, and then we'll be able to design or use specific medication to target those abnormalities. These patients are very motivated to help us to understand what's going on, and because basically this is the only avenue for them to hope for a cure at least, or something that will help them control the symptoms.